Namaste. This is Dr. Satyendra Katewa. I'm a pediatric hematologist, oncologist, and bone marrow transplant physician. I work for Shelby Sanar International Hospital, Gurugram, Delhi NCR region. Friends, there is a complete belt in the world which starts from somewhere the western part of Africa, then it runs through Middle East, and then it runs through India, and then goes up to the eastern part of the Asia, up to Cambodia, and maybe further, where there is a particular disease with the name as sickle cell disease. Now, sickle cell disease is a genetic defect in which the red cells becomes, any stress comes and the red cell becomes sickle shape. Sickle shape means they are not red anymore, they become like a sickle. Now, once they become sickle, secondary to any stress, it can be hypoxia, it can be fever, it can be some drugs. So these sickle cells start stacking onto one another. So there is one sickle, then other sickle, the third sickle, fourth sickle, and they block the flow of the blood through that artery. And that means once they stop the blood flow, the distal part of that organ, distal to that artery, doesn't get the blood, and that means the organ doesn't get the oxygen supply and the nutrition supply. So that part of that organ dies. We call it infarction. That's one of the common problem of sickle cell disease. Now, this can be a problem in the brain where we call it stroke. It can be in lung, it can be in liver, spleen, bones, anywhere. But the pain in the bone is the worst, which we call it, the bone pain and the dactylitis when it is into the hands. It's a very, very severe pain, and the only possible cure is a bone marrow transplant. But before bone marrow transplant, always talk to your doctor if your child is receiving hydroxyurea. It's a drug, and it should be there in each and every patient, and then you can start thinking about the cure. The cure means a bone marrow transplant that has to be allogenic. If the patient has got 1, 2, or 3 brother and sister, they should do HLA typing of the patient and all the siblings. If there is a 100% HLA matched donor, we take that as a donor. It's an easy transplant. We call it matched sibling donor transplant. But if there is no 100% matched donor available in the family, then either we search in the donor registry or we do a 50% matched transplant, whose outcome are also very good in sickle cell disease. But please understand, you do not have to live with the pain throughout your life. It can be cured with a bone marrow transplant, and you should always make sure that you are receiving the drugs which are appropriate for your pain relief. I hope this helps you and you do not have to live like that with the pain, and this will make you smile a bit. Have a great day. Thank you.